Hi there, my name is Dr. Alan O'Reilly. I'm a GP and lactation consultant based in Dublin. I just wanted to create this video to discuss aftercare following a tongue tie release. There is a lot of controversy and mixed opinions in this area, so I just wanted to give you an overview of the background to aftercare with tongue tie release. So basically the frenulum, it's divided by either a laser or a scissors, and there is an open wound left behind. Okay, so a general rule in surgery is the smaller the wound, the smaller the scar. So we'll make reference to that later on. Okay, so there are different types of tongue frenulum. So some can be very thin and some are thicker. Okay, so generally with a thin frenulum, you're going to have a smaller wound at the base of the tongue. So as I said, the smaller the wound, the smaller the scar. So there is less reattachment in thinner frenulum. But when the frenulum is much thicker, there's just much more surface area where you have a thicker base and a thicker top. And when you divide them, you have these two thick areas that just want to knit back together. So there is more reattachment in the thicker ties. Okay. So wound healing, um, just to give you an overview of what is involved here. So inflammation begins at the wound site immediately after the procedure, and granulation tissue arrives, and that is present from 8 hours after the procedure up to day 10. Okay, so that is this white, yellow healing tissue that arrives at the wound site, and it is involved in the healing process. Okay, the wound starts to close, the contraction of the wound, so that starts on day 3 and lasts up until day 10. Okay, so this is what the granulation tissue looks like. I would get a lot of parents sending me photos of this, a little bit concerned, saying, what is this? Is it infected? But this is the normal healing tissue. Okay, as I said, it's present from 8 hours up until day 10. Okay, so you can see after the tongue tie release, there's generally a diamond shaped wound that is left there. Okay, so the theory behind the wound massage is to try and allow this diamond shaped wound to heal vertically rather than horizontally. So if it heals vertically, the theory is that there will be more tongue movement afterwards rather than healing horizontally. So vertically it heals more upward like this, whereas horizontally it's kind of healing on top of each other just like that, you know. So the theory is you will have more movement if it heals vertically. So the Breathe Institute, which is a leading provider in California, um, they recommend their stretching protocol called push, scoop, and stretch. So it said it should just take around 3 seconds, 3 times daily. So it doesn't seem too arduous and usually isn't too uncomfortable for children. Some of them will sleep through it. So they say you push on the wound site at the base of the wound site for 1 second. That's the push. And then you scoop where you lift the finger up so that it rests at the top of the wound. So you're pushing along the wound until it rests at the top of the wound, at the top of the diamond, so to speak. And then you stretch, so you lift the tongue back then at the end. So push, scoop, and stretch. Okay, so the current guidelines produced in Ireland in January 2025 by the Faculty of Pediatrics at the Royal College of Physicians in Ireland. They produced some guidelines, and in the guidelines, it states the authors of the Academy of Breastfeeding Medicine Protocol and the American Academy of Pediatrics Clinical Report also stated there is no evidence to advise post-operative stretches at or near the frenotomy site. Practices worldwide differ, and there is much controversy about whether these exercises should be recommended after frenotomy. Okay, so what were they basing this on, their decision on? It was on a study of almost 600 children, where half had the massage performed and half didn't. And they didn't find any significant difference in terms of the wound healing between these two groups. So this Centre of Excellence, where these procedures were performed, they no longer recommend the massage after they perform this study. Okay, so as I said, overall, the smaller the wound, the smaller the scar. So I definitely wouldn't be recommending any wound massage in some of those thinner frenulums, which are quite common, where there's only a very small wound and very small amount of granulation tissue and a very small amount of rehealing or reattachment, so to speak. If the frenulum is very thick, as I said, there is a higher chance of the wound reattaching, resulting in reduced range of movement. So, so for me, yeah, it's a case by case decision between myself and the parents whether the stretching is worthwhile. And yeah, so as I said, it generally isn't required if the frenulum is very thin, but sometimes where it's very thick, there is, and we see more reattachment in these cases. And for me, the stretching protocol should be considered in these circumstances. Parents should be educated and given the opportunity to try it. And if it's not tolerated, or they find it uncomfortable, or they think the baby is uncomfortable with it, then absolutely do not force it. Okay, I hope you found this helpful. Thank you very much.